Our next speaker is Dr. Madiha Siddiqi. She will talk on prevalence of treatable traits in chronic airway diseases in Pakistan. Dr. Madiha is a consultant and she has significantly contributed to the lung healthcare program at Indus Hospital, focusing on comprehensive management of chronic respiratory diseases. Ma'am, please.
Thank you. Thank you. Our presentation today is prevalence of treatable traits in chronic airway diseases in Pakistan. Just a bit about my team. The lung health program was established in 2019 by a group of pulmonologists, researchers, and program managers. The interventions and impact, we are currently working in the chronic respiratory disease in the prevention wing, the early diagnosis and management, where we do go into communities, and these are funded projects, initiatives where we talk to stakeholders and policymakers around tobacco control measures in Pakistan, where we've sensitized around 3,500 students, and we have done online petitions where we've collected 10,000 plus signatures against the neonicotine products as well as for increased taxation on tobacco. So OLD program, which is the obstructive lung disease program, it is an integrated service within primary care where we've screened around 10,000 patients, 9,000 spirometries done, and around 6,000 patients have been monitored for symptoms and disease control. We do have a pulmonary rehab within our Karachi site, the Kurangi campus, where we do an 8-week intervention of pulmonary rehab. This includes physiotherapy, nutritional counseling, and mental counseling. These are our sites within Pakistan. So the background of my study, reorganization of clinically relevant, measurable, and modifiable features of diseases such as chronic airway diseases, COPD and asthma namely, into treatable traits may allow for targeted management strategies. Since the development of disease occurs at different biological levels, it is necessary to understand treatable traits. This strategy helps distinguish chronic airway diseases as a diverse multi-system illness, recognizes the burden of disease, suitable treatments, and involves relevant teams in a person-centric approach. We sought to describe these in chronic airway diseases diagnosed and managed through the OLD program. It's a retrospective review of medical records from August 21 to October 23. 15 plus years participants with chronic respiratory symptoms were identified and underwent spirometry. The age groups were divided into young, middle, and old age groups. I'll explain the treatable traits later. And the data was analyzed using SPSS for frequencies and comparison of variables like spirometric values, patient characteristics, and exposures using chi-score and p-value statistically significant. So these are some of the common treatable traits we found within our population. Pulmonary features like a low ratio, less than 0.7 FEV1 FEC, a bronchodilator response, airflow obstruction, and categorization into mild, moderate, and severe, and very severe, extrapulmonary coexisting comorbidities, behavioral lifestyle like smoking, biomass burning exposure, and occupations which cause or trigger chronic airway diseases. The results of our study showed that 5,069 patients who were diagnosed of either asthma or COPD, in those patients, around 71% patients had a low ratio. Females were more common, more than half of them were females, and the younger population, which was around 51%, and this was statistically significant. The bronchodilator response was done in 681 patients, and 43% patients had a significant response. In the airflow obstruction severity, moderate severity was 43%. Coexisting comorbidities, we found that cardiovascular diseases were the most common, 82%. The biomass exposure, burning exposure, was found in 70% of these patients, and in never smokers, they were exposed to biomass burning in 75% cases. Smoking history was present in 36%. Occupational exposure of any kind which led or triggered CADs was 52%. And amongst these, most common were farmers, then construction workers, and textile workers. So our study suggests that treatable traits are prevalent in chronic airway disease in Pakistan. Females and younger population is at more risk. While smoking is known cause of CADs, biomass exposure seems to be associated significantly as well with these diseases. These insights provide an opportunity to develop multidimensional assessment and evidence-based personalized management interventions for these patients. So a study utilized a unique approach to study patients suffering with CADs. There have been multiple local studies where these traits have been individually studied. However, more observational studies are needed to be explored. Just adding one more, sorry, I forgot to add here. So amongst our patients with one treatable trait, 39% of the patients had one treatable trait, and 2 or more treatable traits were found in around 45% of our patients. Prevalence and impact of treatable traits has been assessed in chronic airway diseases by Sarah and colleagues among 406 patients with COPD. From the community sample, these traits predicted future decline in lung function, and this included smoking, being underweight, chronic bronchitis, sarcopenia, and breathlessness. Traits that predicted quality of life decline included depression, poor family social support, anemia, chronic bronchitis, disability, and cardiovascular diseases. Findings from a systemic review by Yong and colleagues suggest that multidisciplinary management with therapies targeted at TTTs had the potential to be efficacious when added to the best practice clinical implementation. GOLD, COPD guidelines, and GINA also have mentioned identifying these traits and managing patients knowing them. Through capacity building of healthcare professionals and a programmatic approach, we were able to provide a multidisciplinary team assessment to identify these traits. We established a model of care in a restricted setting, catering patients with low health literacy through trained lung health nurses. We were limited in a way that we had we don't have an established TT framework in Pakistan. Identifying and managing these traits requires additional resourcing, intensive trainings, and multidisciplinary teams working together effectively. These are the references. Just one patient's perspective, a success story, and he's from Gurmani, and you can read the quote where he says, "Assalamu alaikum, my name is Qurban Hassan. When I visited in this hospital, the medical staff listened to my concerns and conducted the necessary tests. Upon receiving the tests, they informed me about my condition and initiated the appropriate treatment. They provided me with a pump, which is an inhaler, and guided me on its usage. Alhamdulillah, I have been consistently using the pump, and my health has significantly improved since then." Thank you.
Thank you very much, Dr. Madiha Siddiqi, for your excellent talk. Now, I would like to ask panelists for their few comments. We are running short of time, so just few comments from the panelists, please.